Lewis Wall.
Tēnā koe te māngai o te committee, ngā mihi ki a koutou katoa, te kaupapa, te hauora o tō tātou iwi o Aotearoa. Mr Speaker, I'm a proud member of the Health Select Committee, and as a member of that Select Committee, it's my responsibility with my colleague, the Honourable Annette King, to hold the government to account. In holding the government to account, what we've done is commissioned an Infometrics report that has revealed a $485 million funding shortfall in the health sector. That shortfall is actually incredibly relevant not only to the 40,000 staff within the health and care sector, but has huge implication to service cuts, and I want to focus my contribution onto what those service cuts may be. So, Mr Chair, one of the worries or concerns I have is that school-based health services will be cut. The latest evaluation of those school-based health services have actually highlighted the benefits to the Year 9 assessments, and particularly to our young boys. Because part of that assessment not only looks at their home life, it looks at education issues, it looks at what sort of activities they're engaged in, it looks at drug and alcohol issues, sexuality issues, but it also focuses quite clearly on suicide and depression. And as we know as a country, suicide is a big issue, particularly for our young people and particularly for young boys. So I have a huge issue if part of the government shortfall of $485 million is going to mean a reduction in school-based health services. I do want to contribute that the Minister reassured us that there would be no cuts in this area, but it's something that I'm particularly interested in and will be keenly watching. The other area that I want to highlight is the provision of maternity services. And unfortunately in Aotearoa, New Zealand, we have over 660 children die every year of perinatal mortality. These are babies who die before 28 days of age. In counties Manukau, DHB, where I'm from, what that represents is 27 deaths that are avoidable. 27 deaths from children, and particularly relevant in my electorate are high concentrations of Māori, high concentrations of Pacific, and high concentrations of our Indian members of our community. But of particular relevance is that 34% of the babies who die, their mothers actually smoke. And that's a really significant statistic, because if we know that smoking is also a cause of perinatal mortality, one of the other areas that I will be focusing on whether or not the government plans to cut, like they did in 2010, any smoking cessation programs. So what we know in 2010 is that there was a $12 million reduction in smoking cessation programs, and I don't think, well, I hope there wasn't a factor about not saving babies, and in New Zealand that's 126 babies who could have been saved from avoidable deaths. I also want to focus my contribution on hospice funding, and the government have been really interesting because they've been crowing about this investment in hospice funding. And again, I want to highlight one of the commitments that the Minister of Health made at the Select Committee. And Mr Chair, he committed to 70% of hospice funding coming from the government. So that's the social contract, I want to call it, that the government have with hospice providers, and there are 29 hospice providers around Aotearoa. And in the South Auckland area, we have 2 hospice providers. We have Totara Hospice South Auckland, and we have Franklin Hospice. And both of those hospice providers, I believe, are doing a fantastic job. And so, again, it's my responsibility to hold this government account to the 70-30 funding split. Because one of the things that I know in engaging with my hospice providers is that, in fact, currently, Totara Hospice receives only 49% funding from the government. So the community of South Auckland are having to find 51% of their $8.4 million budget from a community that's high Māori, that's high Pacific, that's high Indian, that actually has got socio-economic challenges, And so our community is expected to provide 51% of the funding, where in fact the government says that isn't the case. So I will be holding the government accountable to that funding formula, to that social contract, because it's something that they've committed to me in written questions. It's something that they've committed to me and actually my colleagues on the Health Select Committee and our Health Select Committee hearing. And so if that isn't going to be one of the commitments that this government holds to, then me, and I'm sure my colleagues on the Health Select Committee, will making this government accountable to that issue as well. And so as a member of the Health Select Committee, I too want to reiterate that some of the issues that we've been dealing with have actually been driven by the community. And we saw some women come to us this week whose children, through their birth circumstances, have had to be tube fed. And so one of the issues that we have in New Zealand, Mr Chair, is that we have a cohort of child who, through no fault of their own, premature births, have been fed by tubes, some for up to a year. And when they leave hospital, believe it or not, there is no further intervention and engagement with not only the child, but their parents. And so we have children who are dependent on being fed by tubes with no specific support. And in New Zealand, we know that there are over 330 children in this circumstance, and there is no response from the government to meeting the needs of these parents and the children. And so children who leave, they may leave at 1 year of age, and one of the scenarios that was presented to us was children at 3.5 years of age, 4.5 years of age, still being, well, not tube fed, but having, what did they call it, Barbara? The Mickey tube? So this Mickey tube, that essentially means these children are being tube fed because they've had dependency on the circumstances of their birth, unable to eat, gagging. Obviously there's communication issues, there's psychological issues, there's behavioural issues, but these children who are dependent on being fed by a tube. And what do we do to support these children and families? We do nothing. I think New Zealanders would be horrified to think that we just leave parents to their own devices. And so what we're seeing more and more of within the Health Select Committee, because we've got such an unresponsive system, is communities, mothers, people who are affected by a lack of support and a lack of care, coming to the Health Select Committee and saying, please help us. Please hold the Ministry of Health accountable, because unless we can get your support and unless we as a Select Committee hold the Ministry of Health to account, they actually are not meeting the needs of our New Zealand citizens. And I think, as I've said, we're seeing a growing number of our constituents, of our citizens using the petition process to highlight deficiencies in the health system. I actually think it's a sad indictment of the health system, because we should have a more responsive health system. We shouldn't rely on citizens having to go through a democratic process. But in saying that, I'm incredibly grateful that I live in a democracy where citizens can directly engage and citizens can stand up and advocate. And in the instance of those 3 women, it wasn't just for their children, it was for other New Zealand children who are yet to be born, who are living in the circumstances that they're living in. And I think collectively, we as a Health Select Committee, Mr Chair, we're incredibly, proud of, their advocacy, their professionalism, you know, the fact that they cared so much, that they're so passionate, that they're prepared to make sure that our health system is responsive to the needs not only of their children today, but our children in the future. And so I hope that we as a Select Committee are going to do all that we can to make sure that our best practice is about ensuring that children actually who have a premature birth, who are tube fed, actually then have an ability to fully participate in life. Because at the moment, those children aren't able to fully participate in life. their parents aren't fully able to participate in life. It's going to affect their education. It's going to affect a whole lot of things unless we get it right. And what I see at the moment, Mr Chair, is that we've got a system that actually just wants to tick all the boxes. So we have, you know, the better public service targets, and we have the DHBs. So finally, Mr Chair, kia piki te ora.